Hello. Good morning, everyone. It's a pleasure to be here today, and I appreciate the invitation by the Alliance of for Health Policy. I also want to thank Claire for the invitation, and also the board chair of the Alliance, Tanisha Carino. They thought it would be valuable for me to kind of, I think, bring a different perspective. I'm not a health policy guy. I have a lot of respect for everyone that is involved in it. So I'm just going to kind of give you my perspective today around health policy, but also from the lens of primarily from as a corporate board director. I mean, that's going to kind of my lens, but also someone who's practiced medicine for 27 years and worked in different types of organizations. So just kind of give you that kind of feel of things. So with that, here's our agenda. Going to kind of give you a little overview of me. I think Claire tried to highlight some of that, and then we'll talk a little bit about what AI is, very high level. I'll kind of do my best to kind of compare and contrast health policy and corporate governance. And then we'll talk about, I think, some of the benefits of AI and the risk. And I know the panels are going to really dive a lot deeper in this today, so I'll just kind of really, I think, set the stage for conversations later. So, as Claire mentioned, a lot of what I do today is serving on different type of healthcare boards, both for-profit and nonprofit. Spent years working at a health analytics company that got acquired into IBM Watson Health, so I had experience kind of dealing with that in its early infancy in AI, and then also served as a consultant at IBM, during my career too. But my lens as today as a corporate director, as we approach AI, really comes from I teach at two universities. I teach healthcare quality. So for those that are very familiar with the STEEP framework, which is around the 6 aims of delivery of healthcare quality, I kind of always have that lens when I'm thinking about things around technology and AI. And for those who don't know the STEEP framework, it's delivery of healthcare, that it's safe, timely, efficient, effective, equitable, and patient-centered. Those are things that I always try to instill when we're trying to make decisions, are we doing what's right? So, couple definitions. Artificial intelligence, it's a technology that enables computers and machines to simulate human intelligence and problem-solving capabilities. But I do know for a lot of people in the healthcare community, and even myself, kind of think of it more as augmented intelligence, meaning, you kind of leverage AI's, technology to really augment, what humans need to do. And at the end, it's got to be patient-centered. So really, AI, from my perspective, and I think a lot of others, it's a tool to help clinicians and others involved in healthcare kind of deliver healthcare in a better way. So just want to kind of mention that because AI kind of means different things to different people. So just want to make sure I kind of clarify that. So as everyone knows, AI, it's not something that's new. It's been going on for 7 decades, essentially 7 years. But I think we've seen just a huge evolution in healthcare over the past, 10 years, mainly because of, increased computing power, also the ability for machine learning to have a lot more data sets to kind of train on. So you've really just seen this huge progression over the past couple years. But again, healthcare is not the only industry. Every business industry is leveraging or using AI in some way. And I just kind of highlighted just a couple terms real high level because people hear machine learning, deep learning, natural language processing, and again, it's a kind of a type of AI, so just very high level. We're not going deep into that. We really don't have time to do that, today, but just wanted to kind of set that framework. One of the things I want to mention as we go through here today, you'll see various references that I use, and I think Claire is going to provide my slides at the end, but on the very end, I actually have links to all my references and what I did. They're all from peer-reviewed journals, except for, I think, 1 or 2. So, for further reading for all of you, if you want to kind of dive deeper in some of the topics. So let me talk a little bit about corporate governance and kind of comparing, contrasting it to health policy. And it's interesting because, Claire and I were going back and forth by email about this when I was kind of putting this talk together, and there's really nothing published out there that's comparing kind of healthcare corporate governance and health policy. There was one article, it was actually a LinkedIn article that talked about corporate versus political governance, but really nothing that kind of looked at health policy as a whole. So I kind of took a corporate governance kind of, journal, my perspective and my involvement in corporate governance, and then kind of created this slide and kind of some of my, views and perspectives. So some even health policy may disagree with it, but this is Byron's, thoughts on this. So one thing is obviously understand the accountability piece of it. From a corporate governance standpoint, they're shareholders, so as a corporate board, your responsibility to those shareholders. Now, one caveat, for nonprofit boards, they don't have shareholders, they have stakeholders, and those stakeholders typically are, the communities and the patients. So, just kind of make sure you understand there is that subtle difference between a, for-profit and a, nonprofit board. But if you're involved in kind of health policy, your stakeholders are really, society as a whole. And you have just a huge, wider, span of influence. And when you kind of dive into the risk aspects of things, in terms of managing risk, corporations, really, they're managing risk for their shareholders value, but then also for the corporation as a whole. And so they will sometimes, for-profit industries, take risk to generate, value for the shareholders. I mean, that's just the nature of it. It's, you've heard the term risk appetite. I mean, that's just something that boards have to do to really kind of leverage and generate return on investment. Again, doesn't necessarily apply for nonprofit organizations. But if you look at it from a health policy perspective, you're trying to design, policy from a risk standpoint really to eliminate risk, to a patient's health, and also, kind of eliminate anything around, patient safety. So, quite different. But I think, as you look at health policy as a whole, you want to make sure that the policy doesn't, I think, stymie innovation, especially around AI. There's a lot of opportunities, I think, with it. Do we need guardrails? Absolutely. I think so, but I think we have to be very careful, and we'll talk more about that, in a few minutes. But from a compliance standpoint, obviously, both from a health policy, they have internal, compliance, guidelines they have to follow, and then corporations, they, have to do themselves. But one subtle difference, I think, is, organizations have to follow laws and policy, whereas health policy is kind of developing them and setting them, so it's kind of comparing those kind of two different. So just wanted to kind of lay that, kind of groundwork. I look at, both corporate governance, health policy kind of working together. They're kind of complementary. Have one kind of doing things in one higher level, and then you have, corporate governance kind of doing yet another. So I just want to kind of lay that, framework. So when we talk about benefits of AI, and this is where I think, which would be, pretty interested in, and this is by no means an inclusive list. I could probably put 30 things up here, and there's no particular rank order. So just want to make sure that, that's clear. But I think, when you look at benefits of AI, I think administrative efficiency is one thing that I think everyone's looking at. And why is that? Well, in healthcare, what are some of the two biggest issues? You have physician and nurses burnout. The EHR was a big part of that. Honestly, I spent 2/3 of my career paper charting, the last third, using an EHR, and I can understandably, agree with some of the challenges. When you look at generative AI as a way of summarizing clinical notes, I mean, huge value, and I think, you'll find that there's a lot of healthcare organizations, provider organizations really diving into this. I know the hospital where I serve on the board, we're actually doing some pilots around this, now, like other health systems. So that's where I see really a huge benefit, with really kind of diving into AI. But it's interesting, there was a, KPMG did a survey this year, kind of a pulse survey of corporate board directors. Now, not just healthcare, but just, all corporate board directors around administrative efficiency. And boards really expect their organizations to really focus on leveraging generative AI. Like 69% of those corporate board members say they want to see, generative AI really try to bring some operative, efficiency. So there's going to be I think a lot of focus on this. But again, I think it's a win-win for healthcare. This, in my mind, is, I think, a top reason to really look at the benefits. Obviously, there's a lot of research and things that are going on around imaging and AI. I think eventually we're going to get that in such a way to help really improve diagnosis and detection, prevention. But what I'm most excited about is actually looking at what we can do around quality. I'm a quality person, so if AI can improve outcomes, improve safety, improve quality, then that's where we need to be investing our time and energy as a whole. So, and then I'll talk about, fraud prevention. So, as many of you know, a lot of organizations, healthcare and non-healthcare, are using AI tools to do audits. Very common, healthcare industries are using hospital audits are being done, by the auditors using AI tools. So, when you're looking at claims, there are some health insurers that are using it. So I think that's one benefit, obviously, to prevent fraud and abuse and waste. So absolutely kind of, I think embrace it. But in a couple of minutes, when we talk about the risk, I'll bring this topic back up because I think there is, another caveat to this in a second. And then, clinical pharmacology, obviously, drug development, clinical trials. I look at AI as a way with clinical trials to really, increase access, increase the diversity of the patient populations for clinical trials. So, huge benefits there. And again, this is not a, what I would say an inclusive list. It's just a couple things I kind of, in this 20 minutes, decided to kind of focus on and highlight. So we talk about risk. So again, this is not an inclusive list, but I will say I put data and privacy and security as number one for a reason. I will tell you, every one of my board meetings, and then two of my boards have committees. One's a information task force committee, the other one's a science and technology. We talk about cybersecurity risk and AI all the time. I mean, this is front and center in our minds every day. No one wants to, I think, end up being on the news. I mean, everyone was aware of what happened last Friday with the CrowdStrike, and I think these are the concerns with just everything being digital, with technology, and there's still a lot of unknowns with AI. I mean, is it going to improve, reduce risk? We pray and hope so. But the concern is just, what we don't know is whether or not it could actually make us more, vulnerable. So this is, what I say when you talk about risks and vulnerabilities, the number one thing to kind of focus on. I was having a conversation a couple months ago with our CIO at our health plan, and so, he has a very kind of, I think, conservative view about AI. In his mind, he says, we have to make sure we get the right people first, the right processes, get those right, and the right foundational technology before we even dream about laying AI on top of it. And he said it will be very selective, but we're going to get these other things first before we start, kind of laying AI on it, because, if you don't have the people, process, and the foundational technology first, all you're going to do is lay another piece of expensive technology on it, and you're going to end up in the same, bad outputs. So, and that's something that, during my career in consulting with IBM, really talked to clients about. They always wanted the new technology, the shiny new toy, and I said, well, what are your processes? Do you have the right processes first? So that's, I think, the number one thing. And I think as we approach AI, to really reduce, and mitigate privacy and security issues, I think that has to be kind of a foundational thing that we absolutely need to, I think, focus on first. So everyone's heard about, issues around, transparency. Obviously, people always want to know, what's underneath, how this tool was developed, the whole black box, issue. And I think there's absolutely has to continue to be, most importantly, I think, healthcare providers involved in development of AI tools to make sure we get it right. And also to kind of mitigate issues around bias, which we'll, kind of talk about in a minute, too. But informed consent is interesting, because there's times that all of us, we go to a doctor and you're asked to sign a form to get treatment. Not a one of us reads through those forms. You just sign them. I do the same thing when I go see my provider. So, and believe me, I'm pretty sure that there's things in there about AI these days. I honestly think it should probably be on the top of a page in bold print and what you're consenting to do, especially as it means to your data and information. So that's one thing I absolutely think we can do an absolute better job. It even goes to the simple things like wearables. That data is going somewhere. And if you agree to do it, great. But let's just make sure it's real clear and we're transparent about informed consent. So for me, it's important because as a physician, I never did any type of procedure, even a minor one, without really kind of either getting a verbal and or written consent, explaining what I'm going to do and why. So I think, when it comes to AI, we really need to make sure, in any type of data, that we're really making sure patients understand, what's going on and what's being, done. And this week, some of you may have saw this, that the Mayo Clinic, they're doing a pilot for nurse charting using AI. And they made a very public statement about we're getting patient consent first before they progress down this path. So it was kind of very nice to kind of see that kind of approach with it. Now, data monopolies, obviously it's a concern, that if there's a few companies, organizations, and I'm not just picking on them, but, again, who controls your data, who's, dominating the data market is a concern. Some of you may have seen a few months ago, the DOJ is actually announcing, some investigations into some of the large companies around AI dominance. So it'll be interesting to see kind of what transpires with that. And again, it's the conversation of who owns your data. I think as a patient, it's your data. But you also have issues around the hospital claiming they own the data, EHR companies claiming they own the data. There's these questions and issues, but in the end, I firmly believe patients, own it. But it'll be interesting to see kind of how that plays out, around AI going forward. Bias. So, AI has to be trained on diverse data sets. And, there are some insurers that are using, AI to, look at claims denials. And most recently, some Medicare Advantage members, CMS, senators on the Hill, some of you may know this, were asking really to look at it because there's a lot of elderly and very sick people having AI was denying claims. And so the big question is, obviously, is that tool, was it trained on diverse data sets? I don't know the answer, but these are the questions that you want to make sure that there's not, inherent bias in these tools, especially if you're using them, for things like, denials and claims. So these are the things I think you've got to kind of watch, get fixed. And the whole conversation around bias can go in so many directions, but that's just kind of one thing that where AI is being used, currently by, some health insurers. So Claire asked me to kind of, do this, and I kind of put some thought on it. And so, she said, hey, what is one ask of the health policy community would you consider, saying? And so obviously I would say, foster, policy, that is, fosters innovation and development that can benefit, but also protect patients. In the end, we have to make sure whatever we do, we protect patients, protect their data, protect, from a safety standpoint. And then the one thing to remember, and I will say this, is that there are a lot of, corporate board members that are both on for-profit and nonprofit. A lot of my peers, I have a lot of them that, serve on, many, many boards in this country. And they take this seriously. I'm telling you, this is something that keeps us all up at night. Not a one of us ever wants to be involved in our company or organization, having a cybersecurity or an issue, and AI especially. So I will say from a policy standpoint, just, believe that you have another partner that's really kind of looking out from healthcare from that standpoint, both from the provider, I think the health plan, side. So just kind of keep that in mind as you guys are, developing policy, that there are other partners out there that are really, I think, looking at it lens, trying to from the bigger, society view and protecting things. So again, want to say thank you for your time, and here are the references links, so she'll send them out, and like I said, they're all from peer-reviewed journals, and if you need some extra reading or some of these topics, you can kind of dive in. So appreciate your time. Thank you.